But here's the missing part of the conversation. From a public health standpoint, we're very focused on the physical health complications of a diet that is high in sugar, when there's an entire scientific literature documenting the impact of high sugar intake on mental health. And let's not forget that we are currently in a youth mental health crisis. How often do you and your kids make that run to Starbucks, Dunkin Donuts, or your favorite boba stop to get that sugary drink that you've been craving? Hello and welcome to the Dr. Suzette Glasner podcast. Recently, Health and Human Services Secretary RFK Jr. called out Dunkin Donuts and Starbucks specifically for their sugar-loaded drinks and challenged them to present data demonstrating the safety of these sugary drinks for young people, particularly teenage girls.
We're going to ask Dunkin Donuts and Starbucks, show us the safety data that show that it's okay for a teenage girl to drink an iced coffee with 115 grams of sugar in it. I don't think they're going to be able to do it.
Citing the rise in metabolic disorders, RFK summarized the current administration's position on added sugars.
Added sugars, especially sugar-sweetened beverages, drive metabolic disease, and today our government declares war on added sugar.
But here's the missing part of the conversation. From a public health standpoint, we're very focused on the physical health complications of a diet that is high in sugar, when there's an entire scientific literature documenting the impact of high sugar intake on mental health. And let's not forget that we are currently in a youth mental health crisis, with 40% of high school students, according to recent surveys, reporting symptoms of depression and hopelessness, 18% reporting a clinical diagnosis of major depression, and suicide is now the second leading cause of death among young people between the ages of 10 and 24. So if there's any modifiable risk factor like sugar intake that we can address head on in order to reduce the risk of mental health symptoms, syndromes, and tragic outcomes like suicide, that's something to pay really close attention to. In fact, a study just came out that showed the link between sugary beverage consumption and anxiety among young people ages 10 to 19. And they found that teens who consumed high amounts of these types of drinks had a 34% higher odds of an anxiety disorder diagnosis. So today we're going to talk about three questions. The first is, how does that seemingly harmless Starbucks run affect your kids' mental health? And what about us as adults? How does it affect our mental health when we are consuming these sugary sweetened beverages? Number two, how much sugar is too much? There's a lot of mixed messaging about sugar in general, and we need some guidelines so that we can make good decisions. Third, what can we do differently when we're craving that sugar fix or favorite drink to start the day? First, I want to talk a little bit about what is a sugar-sweetened beverage and how does sugar-sweetened beverage intake affect mental health? So sugar-sweetened beverages include sodas, sweetened juices, sweetened milk drinks, energy drinks, and sweetened teas and coffees. And these are the leading sources of added sugars in the American diet. America actually has the highest prevalence worldwide of sweetened sugary beverage consumption. So when you look at global estimates, it's around 11% of the population. When you look at Americans, more than 30% of young American adults ages 15 to 29 consumes sugar-sweetened beverages. And we're seeing this more among females than males. And now, although the dietary guidelines for Americans recommend that any kid who is under 11 should not have any added sugar, we are pretty far from this as a society. 2021 data from the National Survey of Children's Health found that 57%, a little over 57% of kids aged 1 to 5 had consumed a sugar-sweetened beverage in the past 7 days. So we're failing at this. As far as what the impact is on mental health, what studies are starting to show is that higher consumptions of sugar-sweetened beverages has been linked to difficulties with sleep, as you might imagine, and elevated risk of depressive and anxiety symptoms in adolescents. But we also see some of these same kind of trends with adults. So higher sugar-sweetened beverage intake has been found across several studies to be associated with an increased risk of depression. Now, that's not all that surprising because we know that the more sugar in somebody's diet, the more likely or the greater the incidence of depression. Studies show that for every 100 grams of dietary sugar intake per day, there's an increase in the incidence of depression by almost 30%. This new study that I mentioned earlier in kids aged 10 to 19 showed that depending on how often they consumed sugary beverages, their risk of an anxiety disorder was 34% higher if they were in this category of high levels of intake. Let's talk a little bit about why. What is causing this? So first of all, it's probably what we call a bidirectional relationship. So people who have depressive or anxiety symptoms may be more likely to engage in emotional eating as a coping behavior, and then that can lead them to higher consumption of sugar and other healthy food items. Diets high in sugar are also going to cause fluctuations in blood sugar levels, and those fluctuations can lead to mood swings as well as anxiety. Rapid fluctuations in blood sugar level also activate the brain's stress response and releases cortisol, and that also can affect mood stability as well as weight and make someone more prone to obesity and difficulty controlling their weight. So then we have the brain-gut axis theory, and that theory is gaining a lot of traction in terms of leveraging diet and keto diet in particular to regulate mental health symptoms. And the theory is that a high sugar diet reduces the beneficial bacteria that are in your gut and it increases the harmful bacteria. And when you disrupt that balance, that can actually influence your brain function and your mood regulation through the release of inflammatory factors and metabolites. We also have seen in studies that sugar intake may actually lower levels of an important protein known as BDNF. This is called brain-derived neurotrophic factor. And that BDNF protein is really essential for what we refer to as neuroplasticity. So that's the brain's ability to change as you learn new things. And emotional regulation. If you have a decrease in your BDNF levels, that is associated with the development of depression, according to research studies. Then you also have disruptions in your dopamine system, and that is also considered an underlying mechanism of depression and anxiety. So long-term high sugar intake can affect your brain's dopamine system, and that alters your reward mechanisms and your ability to experience pleasure, and that can influence your proneness to depression. So speaking of dopamine, what about addiction? You probably hear people talking about sugar addiction. Is that a real thing? And we are learning that it is. So a study out of UC Davis and UC Berkeley a few years ago found that when they took young people between the ages of 13 and 18 years of age and they deprived them of sugary drinks for just 3 days, they told them to just drink milk and water for 3 days, they reported headaches, cravings for sugary drinks, and other withdrawal symptoms. And that included a decreased motivation to do work, a lack of contentment, and a lack of ability to concentrate, and just lower ratings of overall well-being. This is, in effect, a withdrawal syndrome. And when people experience withdrawal symptoms, that is indicative of an addictive behavior pattern. Our FDA commissioner has actually acknowledged this addiction potential, which is a really good step forward for shaping public health policy and regulation.
We're addicting kids to sugar, and then we're blaming them for the addiction that we created in them. It's insane.
And now, although the study of sugary sweetened beverages addiction potential is really in sort of early stages. We know that these beverages share a number of characteristics with other addictive substances. So first, these beverages are synthesized and manufactured by extracting and concentrating sugar from its original form. Now that's similar to ethanol from fruits or opium from poppies. Second, these sweetened beverages also have the ability to activate these sort of reward-related regions of the brain and physiological kind of responses that can perpetuate consumption. Then finally, and very importantly, the majority of these sugar-sweetened beverages also contain caffeine, and that may also contribute to an addictive-like response. Caffeine withdrawal and intoxication are actually diagnosable conditions in our handbook of mental health disorders. And so experimental research has actually shown that when they test the effects of caffeinated versus non-caffeinated sugary beverages, caffeine increases consumption of sweetened sugary beverages, and caffeinated sugary beverage consumption is predictive of greater risk-taking behaviors in kids, and that can predispose them to other addictions. So caffeine is a real important factor at play here. It's not just the sugar. So now let's spend a moment on how much added sugar is too much. So we know that sugary drinks are the leading source of added sugars in the American diet, and that the American Heart Association recommends limiting added sugar to no more than 25 grams for women per day and 35 grams per men. So just to put that into a little bit of context, what's 25 grams? A teaspoon of sugar is around 4 grams. So our daily limits are about 6 teaspoons of sugar. Unless you're someone who's like really serious about watching your sugar intake or have struggled with a sweet tooth in the past, the American Heart Association's guidelines might seem kind of absurdly low. And that's not entirely your fault, because the average American consumes 17 teaspoons. That's over 70 grams of sugars per day. So that's nearly 3 times the recommended limit. Part of the blame is on that sort of wealth of sugary food options. And there's a lot of talk now about ultra-processed foods and the predominance of sugary food options in our diet that are not adding nutritional value and are essentially empty calories and are leading us to become malnourished even though we're eating a lot. For context, pretty much all of your sweet coffee go-tos are beyond the 25 gram daily sugar limit just in that single drink. So just for an example, a grande Starbucks Frappuccino can have more than 45 to 55 grams of sugar per drink. And that just depends if it's just a Frappuccino or if it's a caramel Frappuccino. And that's not counting whipped cream or syrups. Now, in a 50-gram sugar drink, you've got double the daily limit, 12 teaspoons of sugar just in one drink. Dunkin frozen coffees appear to have substantially more sugar than Starbucks drinks. So a medium frozen coffee can have 81 to 132 grams of sugar, depending on if it's regular or caramel, according to Dunkin's menus. And then let's just talk about boba. A typical 16-ounce boba tea has 30 to 50 grams of sugar. If it's a milk tea, it's going to have 50 grams. But with extras like these decadent toppings or sweetening syrups, you could be looking at upwards of 100 grams of sugar per cup. So you've already quadrupled your daily limit of sugar with that one drink. I want to leave you with some practical strategies. What can you do instead? I've pointed out this big problem with sugars, but what can you actually do? Well, there are a couple of practical ways of reducing your intake of sugary drinks. The first is you can drink sparkling or soda water with a slice of lemon, cucumber, berries, mint, just to get some natural flavors in there. Second, you can replace sugary drinks with water, milk, or sugar-free alternatives. Another option is to switch to low-calorie, artificially sweetened drinks. So there's some debate about that. These should probably be consumed just in moderation. Fourth, you may already know this, but boba drinks can be specified as far as the percent sweetness. So you can say, I just want 25% of the sweetness in my boba drink when you go to order a boba milk tea or a boba tea. Opt for 25%. If you cut that into a quarter, you're going to be closer to that daily limit versus the 100 grams. Energy drinks generally are really hazardous for young people. They have a negative effect on sleep quality, on academic performance and behavior in adolescence. So it's really a good idea to replace those with alternatives that contain less caffeine or none, like tea or herbal tea. And then settle for a tall. I don't know what this is about everybody ordering grande and venti drinks at Starbucks or wherever they go. You don't need that much. You can settle for a tall or smaller size drink, think 12 ounces, not 16, and use other things to sweeten it like cinnamon or sugar-free syrup or some alternatives. So I hope you learned something valuable today, and I look forward to seeing you next time.